and to speak to you about my specialty. I'm a cardiologist. I've done all of my training overseas, where I've completed my Bachelor of Medicine and Surgery at the University of Western Australia, and then I went on to complete my physician training and cardiology training in South Australia, and I'm currently undergoing my subspecialty training in cardiac electrophysiology and pacing. So the first thing I want you to know is, do not worry. The vast majority of you will not know what exactly specialty you will, and a lot of you will actually change your future plans when you start working. So do not panic if you do not know at this stage what specialty you want to go into. So before I start and go into the specifics of cardiology training and subsequent subspecialties in cardiology, I'd like to talk about the general process that you should be going through when thinking about what specialty to go in. The key thing is to try to start building your CV, to try to make it a successful application when you do decide what you want to do. I know there's been previous speakers that have given you general tips and advice, and I'll add a few of them, and hope this helps you get you to whatever career path you decide to choose. In terms of research, just get the principles right. So start with your audits, which I'm sure a lot of you are already undergoing. Make sure that you know how to do a systematic review. Do whatever you can in terms of even a case report that gets eventually published is something that can be a positive thing on your CV. It's something that you don't actually have to do primarily in the area that you're going to go into, because the concepts are across the board. Obviously, it's much better if you know specifically that you want to do cardiology, for instance, to go and approach the head of the department or senior staff members and to start doing small projects that can build onto future bigger ones. Secondly, courses. In general, a lot of you will not be differentiated in terms of knowing specifically what specialty to go into. So do as many of the general courses that'll be positive on your CV, such as the advanced life support. Make sure you've done your basic life support before that, obviously. Attend as many conferences as you can. And the more specific ones, it's a fantastic way to learn at conferences, and secondly, to network. People underestimate the impact of going and approaching people and introducing yourself to different heads of department, different specialists, and also a good way of finding out what that specific specialist did to get into that specialty, and to ask them what they think of their specialty. You'll have different perceptions about how each one of us talks about our different fields. So it's a very valuable thing to go and attend. Taking it back in terms of where you guys are at in terms of your training, try to get as much exposure on the job. By that I mean, when you're doing internal medicine, see if you can go to the cath lab, for instance, and see if coronary angiograms that we perform or electrophysiology studies, get to the different investigations such as echocardiograms, and just to physically see what we're doing, and that'll help you, one, get excited about if you appeal to that specialty, and secondly, to get a better understanding of that investigation, how that can benefit your patient in the future. So even if you don't end up doing that specialty, it'll help narrow the options down for you. In terms of when I personally didn't know that I wanted to do cardiology early on, I was lucky enough to do it as a medical student in my final year of medical school, but it was really when I did my internship that I fell in love with cardiology. It was the one specialty that I feared the most, and I ended up studying a lot of ECGs, because as a junior doctor, you're constantly the first person that actually is asked to review an ECG for a person that's having chest pain, for instance. And I was constantly concerned that I would miss a STEMI or an acute coronary syndrome of some sort. So I was always studying a lot of ECGs as a junior doctor, and that fear turned to more excitement and actually realizing that I enjoyed that specialty. I had a lot of exposure, and that was the important factor. I had good clinical knowledge in the area because I was studying it constantly, but I also had a lot of exposure as an intern, and then subsequently through my resident years, I had multiple rotations in cardiology that confirmed that I definitely wanted to pursue a career in cardiology. A lot of people don't like the high pace, dealing with very sick patients. That you need to be very decisive. Time is of the essence. And if you are dealing with a person with an acute coronary syndrome, for instance, because that's the most common thing that you at your level will be dealing with, you need to act quickly, realize what you're dealing with firstly, and then secondly, start to initiate the necessary investigations and management. As your clinical acumen increases, and your confidence certainly will increase, and over the course of your training in physician and cardiology training, these decisions become easier to make. Across the board, the common thing, whether in Saudi Arabia or overseas, is that the process is you have to go through the physician training program, which is internal medicine, that is, and once you've completed the core requirements of duration and the examinations, you will then be able to apply for your advanced cardiology training. And it's very competitive, so you need to make sure from early on in your physician or internal medicine training, if you haven't decided already, to approach the necessary people and start doing research with them. And showing interest is the most important thing. Making sure that you really are dedicated to becoming a specialist in that field is really important to any of the senior consultants or future people that will make a decision on who are the successful applicants. If you are constantly there, showing up in the cath lab, showing up when you're on the wards, I can guarantee you'll find interns, residents, registrars, and fellows and consultants that will be more than happy to give you added time. So it's make sure you're always constantly motivated and try to show up as much as possible, and that's vital. In terms of where that can take you, cardiology can take you down many different avenues. You don't have to be an interventional cardiologist, but if you, in order to become a cardiologist, just to become an interventional cardiologist, if you are procedurally driven, then interventional cardiology, which is basically people, then we deal with the acute coronary syndromes and putting stents and into the coronary arteries. That is the vast majority of their work. Structural heart disease is also expanding into the interventional cardiology domain, which is very exciting, where they get to fix valves percutaneously. So that is coming from the femoral access, or even from access with the help of the surgeons now, with minimally invasive, so not basically having to give the patient a sternotomy scar in order to fix their valves. So that is an exciting area for the interventional, which is the cardiac electrophysiology and pacing, which unfortunately most general trainees won't have had much exposure to, and because even the general cardiologist doesn't have much exposure to electrophysiology and cardiac pacing, which is quite an important field. Essentially, we deal with rhythm disturbances and arrhythmias and implanting devices into people that, say, for instance, have complete heart block and that are symptomatic. We give them an added quality of life, and essentially it plays a vital role now in all cardiac. I won't get into the very specifics because that will be a lecture on its own of what the field is, but in general, what we do is we are able to now assess more accurately where different arrhythmias are coming from by putting electrodes into the heart. So we gain our access generally from the femoral vein and go up into the heart, where we are able to place different electrodes in different spots and to initiate arrhythmias and to assess basically, and also ablate and burn these different pathways to prevent them from recurring in the future. In previous talks that they've mentioned that you can do an extra sort of 1 year after your training. So in general, your internal medicine is 3 years. Your advanced training is 3 years as well of cardiology. And then you become a cardiologist. And in terms of cardiac electrophysiology, it's a first minimum, I would say, 2 years in order to be quite competent in doing general devices, pacemakers, or larger devices such as implantable cardiac defibrillators, which detect dangerous arrhythmias, try to get you out of it by different algorithms we have, by pacing faster, such as ATP, which is anti-tachycardia pacing, or by delivering a shock if it gets into a dangerous rhythm such as ventricular fibrillation and saves the person's life. In order to be able to do those type of procedures and flutter ablations, atrial fibrillation ablations, and VT ablations, you'd certainly need more than 1 year. The key goal is achieving competency and independence in doing whatever you do. So it's important that whatever specialty you end up in, to always make sure that at the end of it, you've gained all of the necessary skill set in order to work independently. And just lastly, I'll just mention the different other specialties that are commonly pursued afterwards in cardiology, such as imaging. There's lots of opportunity if you prefer not to do the invasive procedures. So you can do echocardiography. There's the cardiac MRI, which is an exciting area as well. Also CT coronary imaging, which a lot of the imaging specialists now do, and a lot of general cardiologists also are taking up. There's also multiple different subspecialties, such as heart failure specialists that you can be, and acute cardiac congenital diseases as well. There's different specialties. I hope this has been helpful, and if you would like any follow-up questions or specific talks for me to give in the future, please feel free to get in touch with me. I'll make sure the Bridge team has my Twitter account details, and I'm more than happy to address those issues for you in the future. Good luck to you. It's an exciting path you've chosen to pursue. I hope I see many of you in the future as future colleagues of mine in the field of cardiology, and I wish you all